Hi, everyone, and welcome back to another entry of the Coronavirus Diaries. Today, my guest is Jon here. Jon is located in Orlando, Florida currently. So, Jon, can you please tell our audience here what you do and how the coronavirus kind of affected you?
Um, we're actually about 30 miles southwest of Orlando, right outside of Disney World. And my wife and I are both employed at local hospitals. She actually drives into Orlando, works at a hospital there, and I work at a hospital just on the outskirts of Orlando. We both work graveyard shifts on the weekends from 7 p.m. to 7 a.m. So we kind of tend to have the busiest portion of the emergency room days, and we both do ultrasound, which is a radiology exam. We check for what used to be just babies, but we check for vascular issues. We check for um, any type of abdominal problems, things with patients like that, cardiovascular issues with patients. So we do as needed by the emergency room physicians all night long. We do radiology exams out here. The way that this virus has changed our specific careers, our specific shifts, is basically through the um, attention that we're paying to the contact that we have with patients now. We always have tended to assume the worst when you walk into a patient's room. You never know what you're going to be meeting the patient with when you walk into a patient's room. You always assume that they have the very worst thing in the world and protect yourself at all times. But now it's just kind of a little more realistic that it's going to be a higher probability that that's the case. So, for instance, when a patient comes into the emergency room, it's their first contact with a physician. So they haven't really had any lab results, haven't had any type of interaction where somebody could figure out, has this patient come in with something super dangerous for the rest of the staff. We're always the first point of contact with them. They come in, let's get this exam done, let's find out what's going on with this patient. So time after time, what happens is the patient will come in, we'll do an exam on them in the ER, they'll be admitted up to the floor. By the time they get up to the floor, they're under full contact precautions, and we've already been in contact with them down in the ER. So the only difference now is that this is happening. I mean, there's a lot more instances of it.
Hmm.
So um, things like, tuberculosis, different strains of the flu have always just been something that we've dealt with. We always try to use a mask if the patient's coughing. If the patient has a fever, we always try to use gloves. We wash our hands constantly. One of the big things that we do that we try to make a habit is you use the alcohol wipe on your hands as you walk into the patient's room, and then as you're walking out, you use it again. We wipe down our equipment with bleach wipes. These are all just things that we do on a normal basis. But now that this um, pandemic is going on in the world, and we're doing it more, um, how do I say it? We're doing it more publicly, making more of a spectacle of it, so that we're putting the patient at ease as well, because they don't know what room we just came out of. So when we're washing our hands, we mention that we're going to wash our hands, and we put on gloves and a mask. We make sure the patient sees that we're using these precautions. That way they're not nervous that we're transmitting something to them as well. But these are all things that, I mean, normal contact precautions it's a normal staple in every hospital setting. And so this really doesn't change our behavior much,
Hmm.
but it is changing our activities. So we're taking a little bit more time, waiting for some lab results to come back before we do certain exams. But besides that, it's not really changing our everyday lives. So
Okay. What's like probably like the most challenging so far right now aspect of your job?
it's as when we're doing exams that are ordered specifically per patient with an emergency room nurse. When a patient walks in the door, they know that they're going to be in contact with that patient. They know that they're going to do this and this and the labs and the IV start, taking samples. They're going to be in contact with that patient for a certain amount of time. As a member of radiology, we're kind of in the back of the department watching and waiting for them to put an order in. And so it's really difficult when you're sitting there to not second guess what the physician is ordering. And so a big thing that goes through the technologist minds like myself is, do they really need that right now? Are you really going to put me in danger to walk into this room with this patient? So the most challenging thing for me has been to keep a level head about the whole thing, and not get too upset by, you really don't want to risk your life over an unnecessary exam. And so you try to second guess what these doctors are ordering or these physician assistants are ordering. And you're like, at this time and day when this person could be literally carrying something that could devastate this entire community, you want us all to go in there and perform these exams for a headache, or something, something ridiculous like that,
Right.
But the most challenging thing is to keep a positive attitude. And especially when, I don't want to say mistakes are made, but there are pauses in care where certain things aren't done rapidly enough or in the wrong order to where you can put yourself into danger because you didn't do the right, you didn't take the right steps to protect yourself. So if you see a patient, you're assuming that everything's fine and dandy. You walk into the room and they don't have a cough, they haven't traveled, they don't have any of the symptoms. So you're going into care for somebody that's just a regular. Maybe she just came in because she's pregnant and just needs an ultrasound to make sure that everything's going okay with the pregnancy. That a really difficult thing is that when you're halfway through that exam and then she mentions that she just got off a flight from somewhere, and then the person that's in the room with her starts coughing behind your shoulder. We didn't test this person over here. We didn't ask them if they had a fever, or, they're just there to watch the ultrasound of the baby. Right. And, now you're being exposed by this, and, this person just got off a flight from who knows where. And, things like that get under your skin at this point in time. You're just like, are you trying to kill me? But for the most part, you just try to keep a level head and get through your shift. And like I said, this is not something that these people don't deal with, that we all don't deal with on a daily basis. It's just more often now. So a lot of things, I talked to a nurse friend of mine that works in the ICU in Colorado, and it's a lot worse there than it is for us at our hospital here. She said that the majority of the issue is that's really challenging for her specifically, is that it's so difficult to treat this. By the time the patients come in that have this COVID-19, by the time they come in, their lungs are at such a decreased capacity that their oxygen saturation rates are so low that it's so hard to treat, and they just feel helpless with this. And it's reminding this particular nurse that I spoke to, it's reminding her of SARS. And back when the SARS epidemic was happening, it's just such a difficult thing to treat. That's what's really infuriating a lot of people. But I think that things are turning around, and that the recovery rates are a lot higher than they expected. So I think this mortality rate is lower. I think they've been calculating it not wrong, but not correctly. I think that there's been the COVID-19, I think, has been around in our community a lot longer than we're thinking, and that a lot more people are testing positive of it because they have the antibodies, because they were exposed to it a lot earlier on, as early as January. So there's a lot of the Wall Street Journal put out a good article this morning that I read about this, that said that we might be calculating this mortality rate all wrong, and that we're expecting it to be something like Italy here, when it's not. It's nothing like, it's not going to hit us like that at all. So we are definitely seeing a lot of infection rate. We're seeing a high infection rate. We're seeing a lot of people, dying from this disease. But on the other hand, how do you tell if somebody has died specifically from this disease? Perhaps they died, but they just test positive for this disease. This flu strain, they could just be in their system, but they died from something completely different, a different strain of the flu even. It's just impossible to know until they get the research done more and death. So I don't know. I think that there's a lot out there that we just don't know yet. And there's a lot of anxiety going on about stuff that we just don't know. It's too early to panic like this. And I think that I think everybody's in the government's done a great job of, making everybody aware of what's going on to the best of their abilities. But like I said, I think it'll be interesting to see the next few days what happens with the spread rate.
Yeah,
But
well, you brought up a lot of good points there. So I guess more kind of focusing on around your area. How's that like? Is when you're like just for example, if you're like walking outside, are you doing your social distancing practice? How are the people around the Orlando
yeah,
area?
where we live specifically is right outside of Walt Disney World. So a lot of the people that we interact with on a daily basis are cast members from Walt Disney World, and a lot of people are just gone. All the vacationers are gone. Our neighborhood is about 50-50 vacationers and families. Last night we had a little party just on the driveway where they sat in their driveway across the street. We sat in ours, and we're staying as far away from people as we can. We go to the store once in a while, but only when we have to, and we make sure we wash our hands thoroughly. If we have to go out into public, just think about everything you touch going to the grocery store. It's every single thing that virus can land on and stay for days and days and days. So as far as my wife and I are concerned, we're living in the be very cautious, do our part, wash as much as we can, try not to transmit to other people as well, but also realize that, our bodies are built to fight off something like this. So most people, 99.9% of people are built to fight this off. So we're not really that scared. But like I said, my wife and I we've walked into rooms with people that are way more dangerous than any of these flu patients. It's just something you get used to as a healthcare worker, is being around infectious people and making sure you take the proper precautions. So around here it's quiet. Disney World's all closed down. I've never seen it like this before. It's a ghost town. There's no planes flying over. The helicopters aren't flying. No hot air balloons. We usually get hot air balloons over our house every morning, being right outside of Disney here, and haven't seen it. And luckily for Florida, I don't want to say luckily for Florida, but with Florida, the central area of Florida, I think because it might have something to do with the warm weather, it's keeping the transmission rate down. I see a lot of the colder climates are getting a faster transmission rate, but Miami and that area down south seems to be a lot faster spreading than up here. We don't have as many cases as the Broward County and Miami-Dade County. So Orange County and Osceola and Polk, I think together we have about 80 cases total. And we got a bunch of them have already, what do you call it?
Just like,
a bunch of them have already been healed or whatever.
Yeah. Oh, recovery, right? Recovery rate?
Released into the wild. Yeah.
Cool.
So.
Nice. So I know you kind of brought up the point. Just kind of from your perspective, why do you think, in Miami, you said it's kind of spreading quicker than compared to Central Florida? Why do you think that?
Stupid spring breakers.
Oh, yeah. I have heard about a bunch of that like happening around the spring breakers. And what do you? Well, speaking of that, what's your opinion on all that?
Faster that everybody's seen the chart where it goes from one person to 3 people to 12 people to everybody's seen that. And when you cut off that one person, that these so you got to figure that's one way of looking at it. The other way of looking at it is the faster we get this thing spread around, the faster it's all going to go away. It's like chicken pox, you got to get it, and then you build up the antibodies, and then you're not susceptible to it. And the faster we get it around our society, the faster that'll be the thing. The whole purpose of this, the bell curve, they're trying to flatten the curve, is to not overwhelm the healthcare system. So the slower we can get the people coming into the emergency room, the more able we'll be to care for them all.
Yep.
it's going to be the same amount of people just spread out over a longer period of time. But that being said, I mean, the dumbest thing you can do is when somebody says there's a pandemic going around of the flu virus, everybody goes to Walt Disney World for the last night before it closes, and they all, they're giving hugs and everything to everybody in these giant crowds of tens of thousands, or they're on the beach and, who knows what kind of viruses are being spread out there already. Be surprised if they don't have a chlamydia outbreak down there as well. But I mean,
Yeah.
Kids are going to be kids though, unless
Yeah.
if you don't make it illegal, they're going to do it. And they don't care.
Right.
I remember that age. I didn't give a crap. You could tell me anything. I don't care.
Right.
I'm kind of that way now. So I don't know.
No, you bring up a really valid point. Just because like I said, I'm putting myself into their shoes at that time because this is like their only time being in college.
Yeah.
And it's like if the government it tells me something to do. It's a rebellious side. Sometimes you can't stop. But at the same time, yes, you're perceived as selfish, but
I mean, these kids have saved up all this money to go to Clearwater for spring break, and that's what we're going to do, And all right, what do unless you stop the flights and you make it illegal to be there, they're going to do it. So I don't know. I don't know what the answer is. You can't just turn off the whole. I understand the theory and the thinking behind it, but it's just not possible to just turn everything off immediately. And, it'll be years before we figure out if that was the correct thing or if it even made a difference,
Right.
I'm sure the transmission rate has dropped tremendously because of this 15-day plan that the government has. But, I mean, like I said, it'll be a year. Who knows,
Yeah.
Who knows? A week from now, it could be 1,000 times worse or complete gone. So.
Right. So I guess, so what do you think in the future, like what can we learn from this? Like how, what's your kind of opinion on that? How can we kind of spread or prevent this if possible?
I hope that people learn to be cleaner. Because, I mean, people are filthy. We see it all the time. We're hyper, we notice it a lot more than other people because we're healthcare workers.
Yep.
But when you walk around and you see the way people let their kids, crawl around on airport floors, or, lick airport windows or handrails or, it's just disgusting the way people let their kids be. And kids are like little transmitters of these diseases. Children are the worst. And I think the one thing that's really going to stop this thing in its tracks is schools being closed down. So I hope that people learn to be cleaner and wash their hands and take their time washing their hands. Don't just, I think a lot of that stuff that's getting out there is going to be positive for the future of humanity. I wish I could say that people would learn that number one, you can't trust government for anything. You can't trust your hospital, your doctor. You can't trust anything on this planet. The planet can turn and kill out the human race in seconds. You can't trust it. The only thing that people can trust is God. And as a believer in God, I believe that he's got everything in control, and this is all his plan, and we'll see what he decides to do. We do our best, to be smart, to be clean, to be helpful, to be good stewards. And in return, we trust in God to do what's going to be best. So not as super religious person, but as a person who believes, I honestly believe that everything has a plan. And if it didn't, boy, could you imagine the shape we'd be in? It'd be a lot worse right now if somebody didn't have total control over all this. So for some reason, nobody knows what God's ultimate purpose is for all of this, but for some reason he's putting us through these checks and balances right now, and we'll come out the other end better for it, I assume. So just like everything else, he'll keep it all together, and this is not the time to turn away and scream at him for anything, but to just be faithful and be trusting him that he's got everything under control. So that's my personal opinion on how we can move into the future, is just assume that he's got everything under control.
Very nice.
So
Very nice. I
and
guess
wash your hands and use toilet paper.
yeah, that's a good point there too. I guess another one, as a radiologist, as a person that works in healthcare, you've kind of already kind of mentioned it, but like, how, what are your advice? You know, just kind of, can you like kind of reinstate your advice of how we can, what we can do? I guess.
During this time,
Yes.
specifically during this time, stay clean, wash your hands. If you are feeling sick at all, just don't go out into public. Call a neighbor and ask them to do your errands for you. Leave it on the step. Just try not to be a transmitter. If you got little kids, try not to let them be little transmitters, and just let this thing pass over. But try to just be clean. Wash your hands. Everything that comes into your house, an Amazon package, everything you touch could have been touched in the last few days by somebody that has this. So remember that after you touch something, don't touch your face, just wash your hands. So that's the most important thing, I think, right now.
Okay. Speaking of like,
And stop panicking and stop blaming people that have no idea what they're doing for this whole thing. I think it's possible that this whole thing was caused by some scientists messing around over in China. I don't know, but don't stop blaming, everybody from your mayor to your governor to your senator to your president. It's not their fault. They're just doing whatever they can to try to keep everything together. It's all falling apart like quicksand underneath them, and they're trying to fill in the holes as fast as they can. So
yeah.
don't get out there. The worst thing you can do is get on social media and start just screaming about how everybody's doing this and we're all going to die because of it. All you're doing is feeding into this frenzy that's not helping anything at all. You're revving everybody up and putting more of a divide in this country. We don't need. The country should be coming together and washing their hands together, not screaming and shouting at each other.
Right. Well, thank you for your perspectives and your opinions there, John. I really appreciate it. Is there anything else you'd like to add?
As long as everybody keeps a good attitude about this, I know it's scary and you're freaking out, but it's unnecessary. This country's been through things like this over and over again. If you're a high school student and you're mad because your graduation is screwed, and you're not going to, your spring break is screwed, just think about the high school kids that were graduating during Vietnam that had nothing to look forward to but a rice paddy. You're actually a lot more fortunate than you think. And I think all of our generations should understand that, how fortunate all of us are at this point in time. We're basically living in the golden era right now. And the swine flu just a few years back killed 16,000 Americans. Right now we're at about 700. So chill out. It's going to be okay. This thing is going to pass. The flu kills a lot of us every year, but a lot of things kill a lot of people. People die every single day, and it's just a natural phenomenon. So relax. Everything's going to be all right. Trust in God. You'll be all right. So, and also if anybody needs anything, look me up and let me know. We've been trying to tell, as healthcare workers, we've been lucky enough not to lose our jobs. We're actually doing pretty well. We're trying to, other ones that I know around are trying to be resources for people that are hurting or anything. So, let me know. Robbie's going to put a link up for my YouTube channel. So if you know anybody in the Florida area that needs any help, any cast members from Disney or anybody that's been displaced, we're trying to help out. So let us know if there's anything we can do to help. But economically, this has been a real bugger, and I hope we get the people taken care of. I think this bill that's coming out through Congress is going to help a lot of people. So, but other than that, I don't know. I don't know what's going to happen, but we'll be all right. We've been all right for centuries.
Right. Well, thanks, John, again. So guys, please just remember to like, subscribe. Please like and subscribe John's channel as well, and anything else. So thanks again there, John. Until next time, guys, we'll see you around.